and I'm pleased to introduce now Camila de Pamphilis, who is the Chief Operating Officer at Mamotest in Argentina. Camila, please go ahead.
Hi everyone, my name is Camila. I believe healthcare must be universal and high quality for all women. I'm the CEO at Mamotest, a company born in Argentina as a response to the very alarming amount of women dying every year due to breast cancer. We designed an effective solution to bridge the gap in the health system and give access to high quality mammograms to every woman. The World Health Organization stated that breast cancer is the most common cancer in the world. 1 of every 8 women will develop it along their lifetime. 2.3 million are diagnosed with breast cancer every year. But I want to look at the amount of women that don't get diagnosed. Not having a diagnosis doesn't mean the cancer is not there, and it's not killing us. 480,000 women die every year of breast cancer due to systemic failures in developing countries. This is as if the entire population of Zurich and Geneva disappeared every year. Impact on women is exponential. Without a mother, 2 of every 3 children in developing countries will not be able to finish school. And in most cases, their family will drop under extreme poverty line. If it is diagnosed in an early stage, breast cancer has a survival rate of 90%, but most women don't have access before they are in an advanced stage, where survival rates drop to less than 27%. Our mission is to create a world where all women have universal access to high-quality medical diagnosis, regardless of where they live or their financial situation. Is to give a woman in the middle of Amazonia the same quality diagnosis that someone in Paris will receive. But it is more than just installing the equipment and using teleradiology. It is about empowering women to make decisions on their own health, about making breast studies available with the best physicians for those who don't have the means for intercity traveling or taking a day off of work, about being able to deliver a diagnosis in less than 24 hours as compared to the average 6 months delay, and most importantly, to deliver an end-to-end solution that helps patients diagnosed with breast cancer navigate through inefficient health systems so they can get a treatment on time. As of today, 87% of women diagnosed with breast cancer within our system were able to receive a life-saving treatment on time. As a B Corp and member of the UN Global Compact, we're constantly measuring our social and economic impact in the world. Last year, we gave access to high-quality diagnosis to more than 60,000 women. 72% of them are at the bottom of the pyramid. With the same amount of money used to treat 1 patient in an advanced cancer stage, the health system can treat 4 of them at an early one. This accounts for drugs, chemo, hospitalizations, and procedures, accounting on $1 million savings per Mamotest center every year. Our target, including Africa and the Americas, is estimated on 300 million women. This is a $5.8 billion market size. We developed 3 business models: private centers, private public centers, and telediagnosis services for health institutions. All 3 models are flexible and adapt to the needs of any context. What is most interesting about this solution is the fact that it is financially sustainable even in the most challenging market conditions, both private and public sectors. Our adaptable business model is capable of reaching its break-even point in just 2 years in Argentina, one of the world's most unstable economies. So imagine what we can accomplish in more stable markets. Merck Sharp and Dohme was our lead investor in our recent Series A round. We are now looking for an extra $10 million in equities and grants. We are expanding our business to Africa and the Americas. We're looking for powerful partners in the healthcare sector. We're looking for capital partners and grants to join us in this exciting journey to help save the women of the world. We don't fear change. We create it. Join us and help 300 million women win a chance to live. You can reach me at camila@mamotest.net. Thank you very much.
Thank you so much, Camila. So now we're turning now to the commentators of the session, and I'm pleased to introduce first Anita Cover, who is the Social Finance Program Manager at UBS Optimum Foundation, the leading branch of UBS that offers clients a platform to drive positive social change. Please, Anita, the floor is yours.
Thank you, Eva. First of all, congratulations to all the ventures that presented today, for all that you have achieved, and also the really great pitches that you just made. So I've been asked to comment these 4 ventures from the investment perspective. First of all, just to give an overview, I think all of the 4 business models we just saw are innovative in different ways. Bamboo has a breakthrough technology for an issue that has been underrepresented. Livox is not only targeting a population that has long been ignored by mainstream startups, but it's also doing this through a cutting-edge technology. And as for Mamotest, while teleradiology platforms have been on the rise, it is really extremely encouraging to see a company that has been able to demonstrate actual health outcomes and early detection outcomes in this space. And for Vula, also, it's a really important communications gap that is being addressed by them between health workers and specialists through technology. So I think all of these 4 enterprises have really interesting business models that address issues that have not really been in the forefront before. And for that reason, they can have a good potential for scale. And so for the financial perspective, it's really appealing as well to see that all 4 companies have been EBITDA positive, despite the fact that they are still quite early stage, and they have actually raised a limited amount of external funding to date. And it will be super interesting to follow the growth of these companies, whether as they grow, they are able to maintain this EBITDA positive state. For that, it will be important, I think, for all the companies to keep focus on the unit economics, narrow down on what their one unit is, and keep that profitable while still growing. Yes, and as for the scalability and the future plans, I think for these 4 ventures, in order to really become game changers for SDG 3, they will need to iterate further and see how they can expand their products into actually verticals. For example, in the case of Bamboo, it is great that Bamboo has a product for hyperthermia and a number of other products as well. It will be important to keep up this pipeline of products for neonatal and prenatal disease diagnostics and cure that they could then continue selling through the same channels that they have already established. Similarly, for Mamotest, mammograms are low-cost mammograms reaching populations that haven't been reached before are a great start, but what will be also interesting to see if there are other teleradiology services that Mamotest can successfully expand to while still keeping their super strong focus on impact. Finally, on the financing, so all 4 companies are raising funds. Before diving into the financing, I think it's just important to take a moment to acknowledge that impact enterprises often have far fewer resources in terms of funding, access to talent, and so on, compared to their commercial counterparts. At the same time, expectations are often higher towards impact enterprises than towards their commercial counterparts. Like we have seen these 4 enterprises today, they are trying to reach populations that have not been reached before, who don't really have access maybe to basic technology, who lack resources otherwise. So, and I think most importantly, most of the business models presented today actually rely on changing customer behavior, which is a super tall order for an impact enterprise. So for that reason, when we look at financing, it does make sense for such companies, I believe, to continue relying on certain amount of grant funding from donors, philanthropists, support from government to develop products, to develop proof of concepts. The next step is then to prove out the business model, so raise social investment capital, soft capital, to prove out that the business is investable. And what we have seen in enterprises that we have invested in is, while it is super important to keep donors and social investors engaged, more successful enterprises already start developing skills early on to pitch to and interact with more commercial investors. So if the 4 enterprises today have this type of opportunities, go for it. I stop here. Thanks a lot for the opportunity.
Thank you so much, Anita. It was very relevant to hear your comments about the financial sustainability of these models. So we're now moving to the next speaker, who is Choma Nwakama. Choma is a youth activist and a medical doctor and the founder of the Smile With Me Foundation, ensuring healthy lives and promoting well-being for all. Please, Choma, the floor is yours.
Hello, everyone. I want to say a very big thank you to UNDP Geneva for this opportunity. And I will also want to start by saying congratulations to the 12 finalists of the GSIV pitch. It's an honor to be here, and I also want to reiterate how inspiring it was for me going through the different innovations, especially in the health category. It wasn't just an opportunity just for me to read through, but it was also an opportunity for me to learn and also to see how much a lot of people are putting in effort to make sure that SDG 3, which is health for all people across all ages, is realized, especially in developing countries. So I'm just going to quickly go through generally, talk through the 4 innovations that are here in this category. We have the Benpo Health, we have Livox, Mamotest, and Rula. I will first start by saying that these solutions are potential game changers for the SDGs because they successfully address the issue of access to health generally, and then reduction in mortality rates, of course. And I particularly love how their business models were very inclusive, particularly involving the people at the bottom of the pyramid, the consumers, and taking into consideration affordability was something I saw across all impacts. And also on the issue of innovation, I want to say that very innovative with the inclusion of digital technology. And I like the fact that they didn't just produce or come up with this digital technology, they actually went the extra mile to educate the users, on how to properly leverage this technology, not just leaving it to them to figure out. Because I'm someone who is very particular about user experience, when it comes to apps, technology, if the user cannot properly use your technology, no matter how awesome your idea is near useless. And I like the fact that the 4 of them, the 4 of you made sure that you not only included digital technology, you also collaborated with the government, with UN agencies, NGOs, and relevant organizations, to make sure that what you have is spread across and it gets to the people who need it the most. Also, I think generally all the impacts were very impressive because, as I said, they took into consideration affordability. Now, going into each of them just briefly, I'll start with mental health. I think this particularly touched me because when I was the going through the pitch, it took me back to the days when I was working in the neonatal care unit here in Nigeria, and I understand the challenges. One of the things that we were always told as young doctors, back then, they would tell us always watch the baby and make sure the baby is breathing. Always make sure the baby is breathing. One of the worst things, it was like a signpost in front of the neonatal care unit. So if you're just coming into the unit, you know that you need to remember that these babies forget to breathe. So when I saw this innovation that is taking into consideration not just hypothermia, but also bradycardia, which is really prevalent in this age bracket, especially amongst preterm babies, I had hope. Let me use that word. I had hope in me that, there's a solution for this. So the temp watch, the apnea boots, and also the fact that Benful Health didn't just provide the temp watch, and the signals, which is awesome. Also the Kanga sling, which took into consideration the fact that that skin to skin moment is something that could be tiring. So it made it easier for parents, to have a longer skin to skin contact with their babies, providing them with the warmth that they need. So, and also I like the fact that they're also working with clinical partners, publishing articles and journals, and that's really good because I'm also keen on research. Then let's talk about Vula. Vula also personally is something I can relate with. The solution, the problem and the solution is something I can relate with. I like the fact that they not only connect primary healthcare workers, with specialists, which is something that it seems trivial, but those few seconds or those few minutes of delay can actually cost a patient's life. I see it every day, and I see how this is a potential game changer, in the healthcare sector in developing nations. And also the fact that they didn't just connect them, but then we have the electronic medical records available that are trackable so that it also reduces the delay that comes with taking history afresh with each patient. So some patients don't know their history, they don't know the drugs they've been taking. That delay has been bypassed, and that's amazing. And then, of course, the time and the transport money that is saved is also remarkable. And I also love the fact that the system provides for data analysis, and the fact that it's open for research. When Anushka was speaking, she talked about how this solution is a game changer in research and talking about tailor-made solutions for the African continent. It's high time Africa started having her own data. When we have our own data, we're able to create solutions that are tailor-made to the African continent. And I think this is wonderful. The impact, the fact that healthcare workers, are taken into consideration is amazing. The clinics and of course the clinical cases recorded are wonderful. So I want to say kudos. And then of course we have Livox. And I would want to say Livox is doing God's work because this is awesome. The fact that over 100 million children, according to UNICEF, have disabilities. This is for lack of a better word, this is just awesome. It's like a walking miracle. So I want to say kudos for this, coming up with this. The fact that it's 20 times faster for communication. You also mentioned it's cheaper, 10 times cheaper, because that's something we have to take into consideration. If you have a product that is not readily available, accessible to people, then you might miss your target audience. And I also love the fact that when you're scaling, you're involving the schools, the government, professionals, and then that the Livox store, the fact that the Livox store is also inclusive for other people to create content that can help. You're taking into consideration that you can't know it all. So it involves the society. And I like that. Then finally, let's go to Argentina. Mamotest. I'm a cancer advocate, and most of the work I do is around cervical and breast cancer awareness, prevention, and treatment. So I totally understand how important early detection is. I've seen the miracle of early detection, and to have a solution that is universal, affordable, and still providing high quality services to women is something that we should all be grateful for. 90%, there's a 90% survival rate if detected early, which was rightly said. And some of the pros that I saw were the awareness. It includes awareness, not just providing the services, but also inclusive of awareness, access, diagnostics, and of course, treatment. So, yeah, I just want to say, just like she closed, Camila said in her closing remarks, she said, we don't fear change, we create it. So I'm happy to say that these four innovations in the health category are not afraid of change. They are not afraid of introducing something that has not been heard before, or trying to alter things that have existed, to create better solutions. They are creating change, and I also encourage everybody here, investors, the UN, NGOs, everybody watching to, look into this great innovations and find out ways that you can partner with them and make our world a better place. So thank you very much.
Thank you so much, Dr. Choma. I think that your views as a medical doctor in Africa have really been an added value to the discussion to understand how this solution can complement the public healthcare system. So we came to the end of the second pitch session, but we have another exciting session before concluding this event. So I invite you to stay online. And I'm now pleased to pass the floor to my colleague, Luisa Bernal.